ST2 and endothelial injury as a link between microangiopathy. ST2 biomarker. ST2 is a biomarker of inflammatory type produced and released by the distension of myocytes when heart damage occurs. Measurement of these markers is useful for diagnosing acute coronary syndrome and cardiac ischemia. Mechanism of endothelial damage in microangiopathy. The term microangiopathy is used to refer a vascular wall injury, mainly arterioles and capillaries, with thickening of the wall, edema and detachment of endothelial cells from the basement membrane. It affects small and medium-sized vessels and organs like retina, central nervous system, and kidney. Lesion in endothelium, the inner layer and the middle muscular layer. Synthesis of substances that influence coagulation. In endothelial damage, there is a hemodynamic regulation of the arterial system. Signs and symptoms of microangiopathy. Chest pain, feeling of tightness or discomfort in the chest, like angina, which may worsen during daily activities and in time of stress. Discomfort in the left arm, jaw, neck, and back, or abdomen associated with the chest pain. Difficulty breathing, tiredness, and lack of energy. Microangiopathy nursing care. Auscultation during the anginal event, and third or fourth noise can be found accompanied by a murmur of mitral insufficiency secondary to ischemia of the papillary muscle, which disappear when the pain subsides. Place the patient in his or her unit, trying to keep it at rest to avoid cutting the coronary blood flow. To evaluate the chest pain: intensity, location, irradiation, duration, precipitating factors, and factors that relieve it, as well as accompanying signs and symptoms: dizziness, diaphoresis, emesis, and pallor. Assess renal function and monitoring the hemodynamic profile. Microangiopathy in Ecuador. According to data collected by the National Institute of Statistics and Census of Ecuador, INEC, in 2014, a total of 4,430 deaths were reported for ischemic heart disease, while for heart failure, deaths reached 1,136. Arrhythmias cardiac deaths total 168 deaths, while deaths due to cardiac arrest in that year were 106. From the total deaths of heart disease, which total almost 12,000, 51.68% of the victims are men, while the remaining 48.32% are women, according to the figures collected by INE. Disadvantages of microangiopathy. The quality of life of a person with microangiopathy with endothelial damage upon entering one or more times in a hospital is very poor. Many of patients who present this pathology do not correct their lifestyle, so the picture may be aggravated. The stress derived from financial problems, concern about a business failure, or loss of work predispose this type of heart disease. In conclusion, cardiovascular disease such as ischemia heart disease, microangiopathy, among others, are still in the number one position in Ecuador's morbidity and mortality statistics. Most of these diseases are due to a sedentary lifestyle in conjunction with unhealthy feeding, and a small part of genetic predisposition and congenital malformations. The nursing care should be oriented basically in the reduction of the pain and anxiety that this disease produces.